Good afternoon. Thank you for joining us. I am Aaron Seib, Interim CEO of the National eHealth Collaborative, and I have the honor of introducing you to this special National eHealth Collaborative Stakeholder Forum. It is a pleasure to be a co-sponsor of National HIT Week as we work together to elevate national attention to the necessity of advancing HIT. We are grateful for your participation in this forum and the participation of the 275 plus folks joining us remotely via webinar. NEHC is a public-private partnership working to advance health information exchange, and we hope that today's presentation spurs a dialogue amongst the community regarding the trust framework necessary to advance exchange. We have worked closely with our public partner, the Office of the National Coordinator for Health IT, to put together today's presentation, focusing on multi-party stakeholder agreements, and to bring together an expert panel to help us explore this and other models to advance health information exchange. By participating in today's stakeholder forum, we hope to share information about the following: the pros and cons of multi-party legal data sharing agreements for health information exchange and aspects of the Data Use and Reciprocal Services Agreement, otherwise known as the DURSA, of the Nationwide Health Information Network Exchange, including considerations related to flow-down requirements and some myth-busting about this tool. We hope that you'll come away from today's discussion with information that will help inform your thinking about multi-party agreements and their applicability to your exchange efforts. The first half of today's forum will begin with an informative presentation from our friend Steve Gravely of Troutman Sanders. Steve Gravely has been working in the health information domain for over 20 years and has been instrumental in establishing the NHIN Exchange's DURSA, the multi-party agreement used by the NHIN Exchange today. Following Steve's presentation, we will all benefit from the expertise and experience of Melissa Hargis, who is the Senior Policy Analyst, this is one of the greatest titles ever, Senior Policy Analyst for State Policy and Stakeholder Engagement and State Policy under the Division of Policy and Planning at the Office of the National Coordinator. This is why I have to have this open.
I didn't decide.
There's about 1,500 syllables in her title. She will work with me and others to facilitate the interactive Q&A that will follow Steve's presentation today. For those of you who are joining us via webinar, please feel free to enter your questions at any time using the Q&A panel on the right-hand side of your webinar screen. You can also email questions to info@nationalehealth.org, or we will be monitoring our Twitter at #NEHC. For those of you here in person today, we will be taking your questions directly during the Q&A following Steve's presentation. In addition to having Melissa's prior experience at the State of Tennessee's, this is her former title, it was a little shorter, HIT Coordinator and Director of the Office of eHealth Initiatives for the State of Tennessee, we will benefit from her perspectives in her current role as the Senior Policy Analyst at ONC. We are fortunate today also to be joined by Molly Smith, who is also from the same program. She is the Project Officer for the ONC State Health Information Exchange Cooperative Agreement Program. We will also be joined by Lisa Jenkins, who is perfect timing. For those of you at the webinar, she's actually just sat down. Lisa is the Director of the State HIE Technical Assistance Program at Deloitte, and she will be involved in providing technical assistance to Molly's program and others, the state grantees of the ONC's HIE program. And with that, please welcome Steve Gravely, who will begin our discussion with an informative presentation on multi-party legal agreements.
Thank you, Aaron. It's a pleasure to be here today and to be here with this distinguished panel. We're going to I'm going to cover some basic concepts of multi-party trust agreements fairly quickly, and then we're hoping to leave a significant amount of time for interaction. So for those of you who are on the webinar, I do encourage you to submit your questions electronically. We very much want to hear those. We want to have the opportunity to engage in a dialogue with you about this important topic. So, whoops.
One more.
Thank you.
Sorry about that, Steve.
Okay. So you can't really talk about data exchange without talking about trust. Trust is embedded in everything that we do. And I think those of us who have been involved in this field for quite a while, as well as those who are relatively new to this field, intuitively understand that it's impossible to separate the concept of trust from the concept of a viable, vital health exchange. The fact of the matter is that in most cases, the exchange of health data is a voluntary activity. And while there are exceptions to that, those really aren't the point of the discussion. By and large, sharing data about anyone's health is largely voluntary. Certainly doing it through an electronic medium at this point is voluntary. And so if we want to incent the rapid adoption of technology to facilitate the exchange of data, we really have to do so in a way that that facilitates and supports trust. And I think we have plenty of examples where we haven't done that particularly well, and the results, unfortunately, validate the fact that trust is foundational to any concept of a viable health data exchange or health exchange activity. Recognizing that, the NHIN work group of the policy, HIT policy, FACA, began grappling with this late last year, and working with NEHC and with ONC, we participated in a process to help the NHIN work group come up with a trust framework, and that's what you see on the slide. This has been endorsed by the NHIN work group and has been submitted to the policy FACA, and I think it's undergone a lot of input from a lot of stakeholders. It is, like everything else in this field, a work in progress, but I think it's a nice encapsulation of the basic fundamental concepts of what it means to have and promote trust in the context of health data exchange. We're not going to have time today to go through this graphic in detail. That's a presentation in and of itself. Many of you, perhaps most of you, participated in the NEHC NINU a few weeks ago, where we actually devoted a couple of hours to talking about the trust framework. And if not, I would encourage you to go online and access that presentation. At a very high level, trust framework incorporates each of these components, which, while discrete, are also integrally related one to the other, which is why the pie chart depiction seems to make sense. You can start anywhere you want to in this pie chart and just go around the circle. Regardless of where you start, you still cover the same basic concepts. That is, there must be some degree of accountability and enforcement in any exchange of data framework. There must be identity and authentication. How do you demonstrate you are who you say you are? How do others know that you are who you say you are? How do you confirm the bona fides of those who are participating in the exchange network? What are the technical requirements? How are they architected and implemented so that they actually support trust? What are the expectations of the parties? Why are we here? What are we hoping to accomplish through participation in an exchange, whether it's the NHIN Exchange or some other exchange mechanism, because certainly the NHIN Exchange is not the be-all and end-all of data exchange. But what are our expectations? What is the expected conduct of those who choose to participate in this activity? Oversight is vital. You can have policies and procedures, you can have technical standards, you can have all manner of state and federal law and regulations that have the force and effect of law, but there must be some means through which you have oversight over the activities that happen within the construct of the exchange, and that oversight needs to be transparent. And then suddenly we're back where we started in terms of accountability and enforcement, and you could continue to go around. So if we take this as a basic trust framework, and again, I wish we had time to unpack it, but we just don't today, then the question becomes, how do you implement that? How do you implement that in a real-world activity such as the NHIN Exchange, or really any other activity for that matter? Well, that brings you to, when you talk about implementation, you've got to take these large concepts that were presented on the previous slide, and you've got to translate them into the real world. You've got to translate them into operations. You do that through tools of trust. So you have the very nice wrench set here that you see, and these are emblematic of the different types of tools of trust that are really common to just about any type of exchange. And I'm just going to click through all of these in the interest of time, and then we will quickly talk about them. And let's actually start at the top. As I said before, oversight is an important activity. Now, there are lots of ways to do that, lots of ways to implement oversight. But the way that is commonly translated in exchanges that exist today, and there are a lot of them in the United States, at the local and state level, and now the NHIN Exchange at the federal level, which is live in production and is exchanging data as we speak, there are governing bodies. There are entities, organizations, committees, they go by many names, that have the responsibility for exercising oversight. Some of them are formal governing organizations. Some are not formal in the sense that they are chartered. They are more ad hoc and situational. But there is a governing body. The concept of a governing body or bodies is a basic tool of trust when we're talking about exchange activities. Certainly, technical specifications are important. Indeed, they are essential. There must be specifications that people understand, that have been developed by those who have expertise in this area, that are knowable, that are enforceable, that are measurable, and those really you have to have in order to facilitate the flow of data. But of course, that's not where it stops, and that's why it is listed as a tool of trust and not the tool of trust. Participant registry, I think you all know what that is. Certainly an important tool of trust in terms of knowing that there is a mechanism by which those who are in an exchange, who are participating through an exchange, are there by design. You don't stumble into the exchange. There is a gating mechanism so that folks are there having gone through some process. Process will vary, of course. There's not a single prescriptive process, but you are not there by accident. You're there because you have met whatever the requirements might be for participation. Certificate authority, another technical tool, but certainly a very important one, in which digital credentials would be issued by perhaps the governing body, perhaps a designee of the governing body, and that is, without that, you cannot exchange information. It's a very important tool of trust, because everyone who is participating in the exchange understands that those digital credentials, A, exist, B, are necessary, and C, that they are not handed out without a demonstration that the person receiving them is entitled to receive them. Policies and procedures, of course, you have to have those to implement all of the, certainly the specifications and the activities associated with the registry and the authority, but also other operational aspects. They become a tool of trust. They're not simply a means to an end. They are important in and of themselves because they codify some of the rules of the road. And so they become a tool of trust. And then finally, trust agreements. Whatever form they take, trust agreements are an important part of the toolbox. They are not the only tool in the toolbox, however. They are simply one of the tools that is in the toolbox.